When it comes to learning about your health, from diseases to deficiencies, there is no substitute for a blood test. To make you a better educated patient, we asked the author of Your Blood Never Lies about the basics of blood work. Blood test results are one of the most important tools your doctor has to keep your health on track.
Looking at your blood is one of the core things that you can do to kind of create a proactive plan to become healthy or to stay healthy.
Clinical nutritionist and best-selling author James LaValle shares some best practices when it comes to understanding our blood tests, starting with the info it provides.
A blood test will show you your risk for diabetes, heart disease risk, how your kidneys are functioning, where your immune system's at.
Most people would be surprised to know a blood test can also show how efficiently our metabolism is working.
For a lot of people, they're struggling with their metabolism, not understanding why they may not be able to lose weight. And that could be things related to stress hormones or blood sugar or thyroid hormones. So there's a lot you can tell from a blood test.
Next up, it's important to understand certain markers or annotations on a blood test, especially since the U.S. is in a full-blown diabetes epidemic, according to James.
Half of the U.S. population is either a person with diabetes or they are pre-diabetic.
He says the majority of us need to pay attention and ask our doctors about the following markers.
Glucose, hemoglobin A1C, which is a long-term marker for how you're controlling your glucose. And then I like getting insulin to find out, are you making too much insulin? Are you insulin resistant? Those are three really important markers.
He says to have a conversation with your doctor about your numbers so you can stay on a healthy path. Most of us will get blood work done once a year. But James says many times our results are skewed because we don't follow fasting directions.
In general, I always recommend that people fast at least 8 hours before their blood test, because if you eat, it could alter your blood sugar, it could alter your triglycerides, it could alter your lipids.
Also, he says to be completely honest with your doctor about alcohol consumption and over-the-counter medication you have taken 24 hours prior to blood work. These can affect the results.
For example, you get up in the morning and you drink 2 cups of coffee. Having that caffeine, if you're measuring a stress hormone called cortisol, it could artificially jack the cortisol up.
To learn more, check out James's book, Your Blood Never Lies, available online and in bookstores. Staying on top of our health and understanding the basics of our blood test.